let's talk about the first case of cryptic pregnancy in Nigeria. Nigeria is my country, so I'm going to start from here. A lot of people have written me to say cryptic pregnancy does not exist, but it does, all right? Before we come out to say something, it is because it has been proven beyond every reasonable doubt that they do exist. The first case of cryptic pregnancy in Nigeria is that of a 19-year-old student from Enugu in southeastern region of Nigeria. Now, we are going to be looking at her stories, and then from this story, we are going to understand how cryptic pregnancy actually presents, all right? There are so many people who kind of argue the fact that cryptic pregnancy exists, but it does exist. And we are going to be reading Miss K's story, and after that we will discuss on what cryptic pregnancy tends to entail. So now we're going into it. Now Miss K is a 19-year-old student who presented to the sick bay at 1:30 p.m. with a history of lower back pain, abdominal discomfort, and constipation. Now, she had reported to the outpatient department of a hospital several months ago with complaint of malaise, all right, repeatedly over time. Now, malaise is a feeling of unwellness. You feel like you were sick. You cannot point at exactly what is wrong with you, that you just feel that you were sick. You could feel tired, you could feel feverish, but you just feel that you were sick. That is what malaise is, okay? The complaint of malaise repeatedly over time. Now, her general practitioner, that's her GP, treated empirically for malaria on each visit. Now, most times when an individual presents with malaise, that feeling of unwellness around this zone, like in this African setting, especially in Nigeria, the first thing that comes to mind is malaria. There are lots of mosquitoes around, so the first thing that would normally come to your mind is malaria, and you want to get treated for malaria. So her GP treated her empirically severally for malaria without even taking a test, okay? So malaria on each visit with same complaint, and they recount that her menstruation was regular, and she kept saying her menstruation was regular, okay? So that is one point to know. Now, at the sick bay, the GP on call asked if she was pregnant, and she vehemently said no. Her period was regular, so it is just normal for her to say no, I am not pregnant, okay? So recounting that she sees her menstruation regularly, okay? So now abdominal examination, however, revealed a gravid uterus of about 36 weeks, and vaginal examination showed that her cervix was fully dilated. When confronted with the situation, Miss K was surprised as well as confused. Now you can imagine that is the situation of a lot of women, okay? No positive test, no bumps, and then you are getting this kind of diagnosis. The late stage of your pregnancy, you will be confused, just like Miss K. However, she only remembered having an unprotected sex many months ago. All right, so she testified, okay, there was a case of a non-protected sex she had many months ago. The baby presented in a frank breech position. To facilitate delivery, a penile maneuver was done. She gave birth via spontaneous vaginal delivery. So I said in one of my videos about induction and delivery in cryptic pregnancy, a woman with cryptic pregnancy goes into labor and deliver normally, just like every other woman, all right? So that is it. You see, Miss K delivered via spontaneous vaginal delivery. A live female baby weighing 3 kg at about 3:14 p.m., all right? That's GMT plus or minus 1, all right? So labor and delivery period was minimal. Miss K was in absolute shock, and that's the case with a lot of women. You would be shocked because there was no indication that you were pregnant. Like, you didn't know you were pregnant. Maybe there could have been some indications, but you didn't know you were pregnant because the visible signs and symptoms of pregnancy were absent, all right? So she was in absolute shock, and that is understandable. She refused to touch the baby. Okay, so these are some of the cases that could result to, you know, postpartum depression, and then the mother transferring aggression to the baby. Okay, so Miss K in this case refused to touch the baby because she didn't know she was even pregnant. So it is even difficult to come to terms with the fact that she has just brought forth a baby. Okay, so it was dramatic as she struggled to accept that she just became a mother. 19 years old student, unplanned pregnancy, and to make it more difficult, she didn't know she was pregnant. Okay, so her parents were invited over by the GP and were surprised to know that the baby is their granddaughter. So the parents were surprised. Okay, Miss K had been living with us. She had not shown any sign of pregnancy. We didn't see any baby bump, so they were surprised. It was even more difficult for the sudden grandmother, that's Miss K mom, a nurse who kept wondering how her daughter's gravity state eluded her. Now, you see, so cryptic pregnancy can actually go unnoticed. So her mom is a nurse, but she didn't know her daughter was pregnant. All right, so due to the peculiarity of the delivery, the GP at the sick bay followed up the case. The baby was christened Peace. All right, and when the GP asked why the name Peace, Miss K replied, the birth of the baby brought unresolved conflict between her family and the male partner's family. Now, this can actually happen because there was no news of pregnancy. Truth is, the male partner must have had unprotected sexual contact with her months ago. But now, this is almost like 9 months after you're coming with a baby. I never saw you with a baby bump. You never came to tell me you were pregnant, and you're appearing with baby bump. So there was actually issues with the male partner's family. All right, so that is why Miss K decided to christen her daughter Peace. All right, with the hope that peace will be restored. Okay, so it was after the baby was born that she realized the reason behind all that she had gone through. All right, she had nausea only when she drank cold water. The nausea eventually stopped. Okay, so that is a sign. All right, but because she didn't know she was pregnant, she didn't take note of that. All right, she admitted noticing slight increase in weight and mild abdominal protrusion. All right, this made her do exercise, which didn't help. All right, so she actually noticed some change in her weight and some abdominal protrusion, but then she felt it was just normal weight gain, and she was exercising a lot to ensure that she loses those fats. Now, she believes her overweight made her and relatives not to suspect pregnancy. Now, in one of my videos, I talked about some of the individuals that their pregnancy can actually go unnoticed, and those are individuals who are overweight. Okay, so here Miss K is saying this must have gone unnoticed because my family didn't know because of my weight. Okay, I was overweight, so it is normal for anybody to feel that, all right, it's just the normal weight that I have, even despite there was a change. Okay, so not suspect pregnant. Now Miss K was confused as she just couldn't understand what was going on with her body, and her GP, who always treated malaria without proper investigation, was of no help either. Okay, so he was always treating malaria without even proper investigation. Now, if he had investigated further, maybe at some point Miss K may have gotten an answer to the reason she was always falling ill or having malaise. All right, they said she would have committed suicide if her gravity state was discovered before delivery. When asked why, she replied, how on earth was she going to explain her gravity state to her parents? That is what happens with young children, all right, when you actually get pregnant when you were not supposed to. These are some of the the possibilities or the scenarios that might tend to play out. All right, so in the case of Miss K, this is what happened. So this is a clear example that cryptic pregnancy does exist. And one thing that actually caused this pregnancy to go unnoticed is the fact that testing do not detect. But in the case of Miss K, she didn't even get to test because all the signs and symptoms were there, but the baby bump was not actually there because it was not big enough to show that she was pregnant. And the fact that she was overweight also contributed to her inability to detect this pregnancy. All right, so cryptic pregnancy does exist, and if for any reason you feel that you might be pregnant despite that there is no positive pregnancy test, ensure that you follow up with your healthcare provider closely. All right, pregnancy tests can be conducted 1 week apart, like every week, until maybe a positive test could be gotten, and then you could be placed on ultrasound monitoring, all right, from time to time until your pregnancy is confirmed. And if you are an individual with irregular menstrual period, you need to actually be more careful, right? Because it can go unnoticed more with people with irregular menstrual period because they're already used to missing their period. And if you're someone with a regular menstrual period and there has been a little abnormality with your period, maybe it has reduced a bit or the frequency, days of flow have reduced, then you need to also ensure you get checked. All right, so that is it. So thank you all so much for watching this video. I hope you enjoyed it. Drop a comment if you need me to clarify anything. Give the video a thumbs up and please share so people understand that yes, cryptic pregnancy does exist. Thank you all so much, and I'll see you in the next one. Bye.